Allô, Nissan? Hey, grosse tempête, hein?
Hey, Karine, oui, je sais, les vilains bonhommes de neige sont de retour.
Mais avec le Nissan Rogue à traction intégrale, c'est pas stressant.
Exact, il est conçu et testé pour nos hivers. Oh, Karine, il y a un bonhomme dans le Rogue.
Ah, c'est correct. J'ai allumé les sièges chauffants.
Ah, bien joué, Karine. Maîtrisez toutes les conditions. Louez le Rogue S 2026 à partir de 0,4% jusqu'à 36 mois, incluant une réduction fidélité de 0,5% pour les clients Nissan admissibles. Jusqu'au 2 mars, sur approbation de crédit, les conditions s'appliquent. Détails chez Nissan.
This week, Quebec Health Minister Christian Dubé introduced a bill requiring new doctors trained in the province to work in Quebec's public health system for 5 years. Those who leave for private practice or move out of the province could face fines of up to $200,000 per day. Dubé saying the policy aims to address a rise in doctors leaving the public system. Government says it invests heavily, and it costs up to $790,000 per physician to train them. Let's find out a little bit more. Dr. Lorne Schweitzer joins us on the line, an infectious disease physician over at the MUHC. Dr. Schweitzer, welcome to the program.
Thanks so much for having me.
Welcome to the show. So let me ask you this. Give me your initial reaction to this bill.
So I think that the government is trying to pull out a stick to fix a problem of their own making in many ways. I was listening to some of your callers yesterday, and what I heard a lot of people describing is something that I've really experienced in working in the public system in Quebec, which is that we're very good at providing high-intensity care when you've had a heart attack or a stroke, but we're not very good at providing very basic care. Things like, I have a sore throat and I think I need an antibiotic for a strep infection, or I have a UTI, or my kid has an ear infection. That's when people seem to be completely dropped. Either they don't have a family doctor, they can't find their family doctor, the family doctor doesn't have availabilities. And so I think that the government is trying to fix this problem, which in many ways they've created by bringing in punitive measures, which I don't think are really going to work. One example, I think, of it being of their own making is that I have many friends who are native Montrealers who either went to med school elsewhere or even did their med school here and then went elsewhere for residency. And the government plans so tightly what they call their physician manpower plan that these people, despite wanting to come back, being from here, wanting to practice in our public healthcare system, find themselves completely unable to do so.
So when you say they're unable to do so, give me a little bit more detail on that. I find that astounding. What's keeping them from it?
I agree. It really is astounding. So one thing is if you do, for example, many specialties like my own are basically a two-step training process where the first step is you train in a base specialty like internal medicine or pediatrics, and then you go and you train in a subspecialty like cardiology or gastroenterology or infectious diseases. The way that it works is once you finish your internal medicine residency, then you go and you apply for the next stage of training. If you were trained in internal medicine outside of Quebec, even if you did your medical school here, they are very restrictive on how many people can actually go into these fellowship positions. And they only allow for many of those positions people who trained in internal medicine or pediatrics in Quebec to apply. Mm-hmm. So for example, I have a friend of mine who went to McGill, decided he wanted to go to the University of Ottawa, literally just across the river from Quebec, to do his residency training in internal medicine. And when it came time that he wanted to come back here to do infectious diseases, couldn't do it. Ended up out west, and then has still been unable to return to Quebec. I have another friend of mine who trained in internal medicine here, wanted to train in infectious diseases here, but that year the government decided to cut spots. He ended up training out west, met his wife, never came back. So people, when they have to leave the province, I've had colleagues call them the exiles, in fact. Often there are barriers to them coming back, either that they can't find a training position or they build a life elsewhere and end up not coming back, even if they originally wanted to.
Okay, let me ask you this aspect of this whole affair, because to be honest, my initial gut reaction when I saw this story was, well, to me, it kind of makes sense. If someone's going to train here and the public purse, right, the taxpayer is going to put in quite a bit of money to train that doctor, it sort of seemed fair to me to require that you contribute to the public system. Now, maybe the length of time, 5 years, is too much, but it sort of seems to make sense to me. What do you say to that? Because I know I'm not the only one who has at least that gut reaction to the plan.
Absolutely, and I certainly understand that reaction. It's hard for me to say what pushes people to the private sector because I'm in a specialty where there's just no market for it. So everyone I know in my specialty, including myself, practices on RAMQ in the public sector. What I can say is that one way that the government makes it very difficult to find a job, particularly for family doctors, is what are called PEMS and PREMS, where essentially the government will make a 5-year plan where they say exactly how many doctors can practice in a given region, a given hospital, even a given sub-region for family doctors. And so a lot of people finish their residency, want to go and practice in places where people need family doctors, for example, but are unable to find a job be in that region because of these overly restrictive policies. And so often people are either leaving the public system, going private, or leaving the province entirely, not of their own accord, but because, amazingly enough, they can't find jobs.
That's, man, that to hear that, right? It seems like we're not touching the real issue here if that is happening, right? Because clearly we want doctors in this province, and to create a system where people feel like they don't have a chance or there's not a spot for them is kind of unbelievable. We're with Dr. Lorne Schweitzer, infectious disease physician at the MUHC. Dr. Schweitzer, let's say I could sit you down in a room with the Health Minister, Christian Dubé, maybe also with the new director of Santé Quebec, right? What would be your plan to them? What would you tell them would be the way to fix the issue they're trying to fix?
Well, if I had that answer, I think I'd be a very rich man. It's a very, very complex, difficult thing to fix for sure. Unfortunately, what I've seen in the system is that every 8 to 10 years, some new minister comes along with some great plan to fix everything, and it ends up, and then in 8 to 10 years, someone else has to fix whatever happened in that great plan. So it remains to be seen what will happen with Santé Quebec. What I think is that this top-down bureaucratic approach that everything should be run centrally from Quebec City doesn't work, because I think the needs of somebody living in NDG, for example, are probably different than the needs of somebody living in Saguenay. And so this idea, this cookie-cutter, overly centralized approach, and a very inflexible approach, I think stops us from being flexible enough to take opportunities. For example, take on a new physician who may not be there next year or the year after when they allow us to take a person on. The other thing I would say is, they're always talking about cutting administrative costs, but the administration, it can actually be helpful. Having an admin assistant to make sure that my patients get their appointments, are called and know they have their appointments and know where to show up, takes a lot of stress off of nurses and doctors and other professionals who could really be seeing more patients and doing their job. And then the third thing I would say is that our information technology is structure is completely antiquated. When Christian Dubé became health minister, he said he was going to get rid of the fax machine. 3 years later, I'm still sending faxes.
Oh my goodness.
And it's 2024, almost 2025, and our healthcare system works on faxes. Recently, we found out we couldn't stamp the cards anymore because the one ink supplier has gone out of business.
Oh my God. Wow.
So if I'm at the MUHC and somebody is seen across the street at the Queen Elizabeth Health Complex, I can't see any of their notes. Yeah. So I think that there's so many efficiencies that could be made because so many things are duplicated or done in triplicate or even more, tests, imaging, and the like, because we just can't access it because of our outdated IT systems. So I would actually say that is probably the number one frustration for any doctor working in the system right now.
Dr. Schweitzer, last question here is, you could probably be a doctor anywhere if you chose to go somewhere else. Why do you choose Quebec? Why are you still here?
So I chose to come back. I did my training in the States, and I came back here because at the end of the day, I think that we have it's a great place to live. It's a wonderful place to raise a family. And despite all the problems in our system, of which there are many, when you work hard and you want to give people really good quality care, you may be in spite of rather than because of the system, but we always find a way to do it.
A good way to end off this interview. Dr. Schweitzer, appreciate your time.
Thank you so much.
Dr. Lorne Schweitzer is an infectious disease physician over at the MUHC.